If you're more than a year post ACL surgery and still dealing with knee pain, hesitation, or fear when it comes to running or playing sports, you're not alone. In fact, studies actually show 1 in 3 people are stuck in this exact stage. So in this video, I'm going to walk you through the 3 most common mistakes that I see with people who are over 1 year post-op and still unable to get back to running or sports. And I'm going to show you how to solve each problem. If you're new to this channel, my name is Josh Erwanto. I'm a physical therapist and I specialize in ACLs and returning to sport. And I've helped over 200 people through this exact stage. So let's dive into the video. The first mistake is thinking that it's the surgery's fault. Now, I want to be clear. Sometimes it could be a surgery or a surgeon's mistake, but 9 out of 10 times it's not. And here's what I see all the time. Someone's a year post-op or more. They still have pain in their knee when they try to run or play sports. So they go back to their surgeon thinking it's something to do with the knee, with the ACL, or something went wrong in this whole process. So they ask for imaging, get an MRI just to check. But here's the problem. Depending on where you live, that wait time to see your surgeon, get the imaging done, wait for the results, it can vary from 3 to 9 to 12 months depending on where you live. So potentially, that's 3 to 9 months where you're waiting for an answer where you could be actively working on the solution in the first place. And what most people don't realize is that muscle atrophy, or the process of losing muscle, can happen in as little as 2 weeks. So if you're waiting 3 to 9 months to get an answer, again, there's nothing wrong with that. But what I see all the time is that in that time, you could be actively actually solving the issue through a different approach. So potentially during that wait time, you're putting your rehab on hold, muscles start atrophying, getting weaker over the 3 to 9 months. That's a huge problem because that's going to set you back even further by the time you get an answer from the surgeon. And most times the imaging results come back and the ACL is fine, the graft's completely fine. The surgeon will just tell you to go back to do your physical therapy and keep strengthening. Again, I'm not saying every single time it's going to be like this, but I would say 9 out of 10 times it's not the surgery's fault. It's not an ACL's fault. It's likely a rehab issue. So the problem likely wasn't the surgery. The problem was that the rehab plan never fully addressed the deficits, the weaknesses that your body actually needed. So here's what to do instead. First, realize that the ACL injury is not like any other injury. So my suggestion is to find a professional, a physical therapist that really knows what they're doing. Somebody who sees ACL rehab at least once a week, twice a week, even better if they see it daily. And let them assess whether your issue is actually a rehab issue, which can be fixed with the right plan, or the 10%, the 1 out of 10 times where it's actually structural and something needed to be checked out from imaging. And again, most of the time, the issue that you're having is likely a rehab issue. And you can start solving this immediately instead of waiting 3 to 9 months for a scan that's not going to tell you much. So mistake number 2 is thinking that waiting more time is going to solve the issue. Unfortunately, it won't. And I say that very confidently because I speak to ACL rehabbers every single day. And from the people I speak to, there's huge variance. One side are people who are 1 year, 2 years, 5 years post-op and still struggling with using the stairs, with walking for a long time. And there's people who are at 1 year, a year and a half, who are completely doing their sports pain-free, fully confident. So it's clearly not about the time. And there's so many research studies that support this as well. If you've been told by your surgeon or physical therapist just to keep waiting and just wait it out, keep strengthening, keep going, there's nothing wrong with those advice, but waiting more time is not going to solve it. So here's what to do instead. You've got to prioritize your rehab. Just like anything in life, if you want to solve anything, if you want to get better at anything, you've got to put it high on your priority list. Now, I'm speaking to the people who have life responsibilities. As we get older, as we're not in our teenage years anymore, there's more things in life that we got to take care of. Family, work, whatever else you got going on. And guess what? The issues in your knee, the pain, the hesitation, the fear, is going to follow you no matter what age you are. So it is completely up to you, your decision, to finally solve this once and for all. Or do you want to keep carrying this knee pain with you for the rest of your life? Now, the good news is if you do commit to a plan, a structure, a solution that's actually going to help your knee once and for all, then you have a great chance of solving these issues in honestly less than a year, depending on whatever's going on. Because I speak to people who are 1 year, 2 years, 3 years post-op, struggling with pain that they've had since day one. And with the right structure, the consistency, and the commitment, things can change really fast in a matter of months. So it's better to do it right once rather than doing it half-heartedly for many years. Now, here's the third mistake, and I'm going to give you a very specific rule that might change how you approach your rehab. The third mistake is not knowing when to change your plan. Here's a simple rule that I want you to use. Let's say your main problem is knee pain when you try to run, and you've been doing all the exercises consistently, everything that your PT has been telling you to do. I have the 4-week rule, where if you don't see any changes, any improvement in your situation in 4 weeks, then something's gonna change. So the rule is 4 weeks, not 4 months, not waiting more time to see what happens. 4 weeks. That's enough time to give your knee and your body to adapt to something. See, our bodies are very resilient and very quick to adapt if you give it the right things. So in 4 weeks, that's more than enough time to see some sort of change, improvement, progress to whatever situation you got going on. If nothing has changed in more than 4 weeks, then the plan and the approach you're doing is not working. So here's the trap that most people get into. Let's say it's knee pain when you run. They tell their PT tells them to do these exercises, go home. So you go home, do your exercises, you come back to your PT 2 to 3 weeks later and tell them that nothing has changed and it's still painful. Probably tell you to do more exercises, to keep consistent and keep going. If you've been consistent with everything that they've told you to do and nothing has changed in 4 weeks, then it's time to reassess. Likely something in that current thing you're doing, in that approach, is not working and it needs to be addressed with a different angle. Now you're probably thinking, what is the solution then? Like what can I do? It's hard to say. Everybody has a different situation, but likely it's some kind of mobility issue that hasn't been addressed. It could be a previous injury history that you've had before the ACL that has been compensating. Most of the time what I see is that there's certain exercises in your program that's just not targeted and built for you to get back to running and sports. But whatever it is, something is missing from the current thing that you're doing. And waiting longer isn't going to solve that. So here's what to do instead. You got to advocate for yourself. You got to set a 4-week personal checklist. So that means every time you try something new, let's say you've been given a new set of exercises to do. Now you track those progress to see in 4 weeks, am I making an improvement? Am I progressing the right way? Am I having less pain? You got to track this yourself. And if you're not seeing progress in 4 weeks, then it's time to adapt or change the plan. And that doesn't mean quit. You just gotta bring it up to your PT, maybe get a second opinion, but whatever you do, don't settle for the fact that things haven't improved in more than 4 weeks. If you wanna see how I approach ACL rehab differently for people who are stuck at 1 year or more post-op, I put together a free video training that you can watch so you can learn my process. I'll drop that link in the description. So in summary, there are 3 common mistakes for people who are still stuck at 1 year or more. Number 1, the surgery may not be the issue. Number 2, don't settle for waiting longer because it's not going to solve anything. And number 3, use the 4-week test to see if things have changed or not within 4 weeks. Whatever situation you got going on, keep going, you got this, and I'll see you in the next one.